In today's session, we'll continue with hepatic diseases, page number 449 onwards, those who have the textbook, page number 449 onwards. So if anyone is joining late, please help them out with the page numbers. So hepatic diseases, when a patient, a child or even an adult patient, when they are suffering from hepatic diseases, the main aim of nutrition here is to provide as many as liberal calories as possible through carbohydrate, okay, so that you can prevent hypoglycemia, hypoalbuminemia, hypokalemia, okay. Calories and electrolytes should be on point. You should not reduce that, okay. You can be a little bit strict with protein. Protein could be adequate, whatever is required, that, okay. You have to put the patient on low fat diet, because if the patient is on high fat diet, too much of fat, the patient may suffer from delayed gastric emptying. Means the because of high fat content in the diet, the food is not leaving the body, leaving the stomach at the right time. It's taking a longer duration, the food is being in the stomach, okay. So that would lead to situations like nausea, vomiting, okay. So it's better to put the patient who has hepatic diseases on a low fat diet. It is much better tolerated. So protein could be adequate. Put the patient on low fat diet, and when you're choosing the fat, okay, choosing the correct form of fat is very important when dealing with hepatic conditions, okay. Like MCT, that is medium chain triglyceride, for example coconut oil, okay. MCT oils are sold in the market as well, that can also be used, okay. Whenever you're preparing food, it's better to use MCT based preparations, medium chain triglycerides, not long chain, not short chain. Medium chain triglyceride is preferred, it is better tolerated, okay. And phospholipids has shown, any food rich in phospholipid has shown to improve the way how the liver gets better, okay. The liver regenerates itself and the appetite improves with phospholipids. Phospholipid extracts can also be found, okay, it can be prescribed. So foods that are rich in phospholipids like soya beans and all, they're good for people who suffer from hepatic conditions. So in general, these are the main categories of areas or guiding principles of people who suffer from hepatic diseases. Okay, you will see MCT oils coming again and again in the topics related to um, hepatic diseases, also low fat MCT, and also phospholipids. Okay, being liberal with with carbohydrates in form of glucose or dextrose parenteral nutrition, that is also followed here. Hepatic encephalopathy. If a patient is diagnosed with hepatic encephalopathy, the main aim here is to reduce the ammonia level as much as possible to support the liver function also. And also you have to make sure that you avoid protein by mouth, orally avoid taking protein, okay. Branch chain amino acids can be given, but avoid taking protein via mouth, okay. Because that would lead to too much of ammonia in the body, too much of nitrogen in the body, and the liver will not be able to digest it, okay. So next, in when it comes to antibiotic, oral antibiotics are given so that the gut can be sterilized, unwanted bacteria can be killed, okay. Rifaximin is one of the antibiotic used. Ampicillin can also be used. Neomycin is not used recently. Ampicillin and neomycin are not used. Rifaximin is used to sterilize the gut, to kill the unwanted bacteria or to kill all the bacteria. Then after killing all the bacteria, lactulose and lactobacilli can be given. You are introducing good bacteria back into the system. Okay, lactulose 1 to 2 ml per kg per day. In this way, it is divided. Until and unless the patient is suffering from diarrhea, 30 ml per dose is given. And until the patient recovers from diarrhea, 30 ml per dose is given. Then lactobacilli medication can be given orally to bring back the good bacilli. A calorie requirement is based on the RDA of the individual's age, gender, activity level, based on the RDA plus 10% extra. Additional 10 to 20% is given because the patient is undergoing a systemic challenge. Okay. To prevent catabolism, additional 10 to 20% extra calories can be given. As much as possible, calories should be given because 10% of glucose, 25% of dextrose, okay, this can be given through intravenous fluids. Blood transfusion, if required, will be given. Salt-free albumin is given. Vitamin K is also supplemented. Branch chain amino acids are given, like valine, leucine, isoleucine. Okay, they help in liver regeneration. Multivitamins are also orally administered, and zinc supplements as well. Glucagon is a hormone, 3 mg per kg per day is given. That also helps in liver regeneration and to prevent hypoglycemia. Glucagon is the hormone actually secreted by pancreas, but when the patient is undergoing hepatic encephalopathy, additional glucagon, which the pancreas are not able to secrete or not able to secrete up to the body's requirement, that can be administered artificially. Chronic liver disease. While dealing with chronic liver disease, medium chain triglyceride, as mentioned earlier, either MCT formula or coconut oil can be used for food. If the patient is suffering from fat malabsorption, not able to absorb fat from the intestine, the body can better process MCT as compared to other types of oils or lipids. Fat soluble vitamins, vitamin E and vitamin A can be given. Vitamin A, 10,000 to 15,000 international units per day is the dosage we prescribe here. And when it comes to vitamin E, 5 to 500 international units on a daily basis can be given in the form of tocopherol injections. Vitamin D in the form of calcitrol is given once a week or on a daily basis based on the dosage. Vitamin K, 2.5 to 5 mg on alternate days. One day they will give vitamin K, next day they will not. Okay, in the water soluble menadone solution or orally, or injection of vitamin K, 5 mg twice a month can also be given. Water soluble vitamins, twice the requirement of daily. For example, if an adult requires 80 mg of vitamin C on a daily basis, 160 mg will be given when the patient is suffering from any hepatic degenerative disease, so that the regeneration can be started. And other medications, cholesterol medication or retaining cholesterol, retaining bile acids, okay, specific prescription can be given by the prescribing doctor or the consulting doctor. Next, coming to other GI diseases, gastrointestinal diseases like malabsorption. Malabsorption when the baby is not able to absorb nutrients from the intestine. That is what we call as malabsorption. And in cases of malabsorption, If the child is still being breastfed, is under the breastfeeding age, breastfeeding should be continued. Do not stop breastfeeding. Okay, usually in cases of malabsorption, you will find disaccharide deficiency. It's a form of carbohydrate, it's a form of glucose, disaccharide. Okay, that is the most common deficiency seen. Okay, lactose intolerance is also seen. So if watery diarrhea is seen due to acidic stool or presence of more than two motions in two separate testing, you find the patient is having watery diarrhea. And if the pH is less than 5.6, it means the patient may be suffering from lactose intolerance. Okay, you have to continue breastfeeding and stop all the artificial feeding. You have to give the patient curd and yogurt, introduce curd and yogurt. Soya milk can be started if it is necessary. You can stop breastfeeding and start soya milk for very young infants. In older children, you can shift to pulses and cereals that does not have lactose at all. That can be continued with family pot feeding. Whatever is prepared in the family, the same food is given to the growing children. Protein malabsorption, called creatoria, that is seen if the patient is allergic to chicken. So in this situation, the patient may require an supplementation of an enzyme called protease enzyme. Okay, only if the child is not able to produce protease enzyme from the pancreas, or it is not enough to digest the protein, then protease enzyme artificially has to be taken through supplementation. MCT oil can be given here as well. Coconut oil or MCT solutions can be given. And on top of that, all the fat soluble and water soluble vitamin supplementation should be started so that the patient does not go into the stage of deficiency. Next, coming to pancreatic insufficiency, when the pancreas are not able to produce adequate amount of uh, enzymes or hormones, either in form of cystic fibrosis or pancreatic insufficiency. Steatoria may occur. Steatoria means large amount of fat is lost from the body through excreta. Okay. So again, this is because of defective luminal digestion in the lumen, that is in the intestine. Digestion is not taking place properly. And that is why steatoria happens. Okay. So fat can be given here in the form of MCT. All MCT fat can be given. Coconut oil can be given. And some people may require pancreatic enzyme replacement therapy. All the enzymes that the pancreas is producing, that enzyme will be given artificially. Hormones produced by the pancreas, that will also be given artificially. So that is PERT. Okay, PERT stands for pancreatic enzyme replacement therapy. And these doses are based on the dose of lipase, around 6,000 international units of lipase, 4,500 international units of amylase, 300 international units of protease. Okay, these are the enzymes produced by the pancreas: lipase, amylase, protease. Okay, and even after giving this therapy, if the steatoria does not improve, you may have to give antacid like ranitidine, okay, to the patient, or any enzyme to control the hydrochloric acid production. So omeprazole, proton pump inhibitor, okay, these can be given to reduce the hydrochloric acid secretion. And these drugs can be mixed with meal. If you're dealing with small kids, you can mix these drugs with meal, mix it up with meal. They will not identify the taste and give it to the child. That's how you manage the pancreatic insufficiency. Diet in bowel resection or short bowel syndrome. Either you are removing a part of small intestine, or the patient is born with a small or short small intestine. Okay. So Here the patient may be dependent on parenteral nutrition. Okay, parenteral nutrition, that is IV, through IV fluids, or through central line. Okay, nutrition is given. So this is seen when 20% of the intestine is removed. Okay, either there was cancer or necrosis or any infection, okay, because of which, tumor, okay, or inefficiency, because of which a part of the small intestine is surgically removed. 20% of the length of the small intestine could be removed. If it is that, parenteral nutrition will be started. It will take months for the patient to come back to a normal excretion. The first few weeks after parenteral nutrition, it is completely watery stools that the patient will excrete. Okay, it's not hard stools, completely watery diarrheal stools. And in the second stage, it will take up to 6 months. Slowly, the diarrhea will reduce. So, till 6 months, the patient is suffering from diarrhea, profuse watery diarrhea. And in the third stage, the patient becomes more stable, can tolerate a little bit more advanced food, and thus the stools also become harder. Okay, it takes at least 6 months for the patient to recover from short bowel syndrome or bowel resection. Short chain fatty acids can also be used. Carbohydrate is medium chain fatty acids can be used as well. B12 deficiency may occur because if the terminal part of the intestine is removed, they are responsible for B12 absorption. Okay, so B12 deficiency can take place. So B12 supplementation will be given. Next is celiac disease. Celiac disease or celiac sprue, both are the same, celiac disease or celiac sprue. So this is not a, this is like an immune mediated destruction. Okay, the patient's own immunity will destroy its villi. Okay, you can see here in the image, these are the normal villi that you find in the small intestine. They are supposed to latch onto the food and absorb the nutrients from the food. Okay, and when the patient's own immunity is destroying this intestinal villi, you get damaged villi. Okay, you get this damaged villi. This is the damaged lining. No absorption will take place here. Okay, so this is celiac disease when the patient's own immunity, or they may be born with short villi, or their own immunity is destroying the uh, intestinal villi. Okay, because why this destruction is taking place? Because the body is allergic to a specific protein called gluten. Okay, gluten, which is found in wheat and some other grains as well to an extent. When the body is allergic to gluten, they cannot digest wheat. Okay, and as a form of this allergic reaction, immune system will become hyperactive, hypervigilant, and it will go and destroy the normal villi so that no absorption of gluten should take place. Okay, just a minute, 1 second. So yeah, gluten-free diet is recommended here. Okay. Uh, So what happens in celiac disease, as soon as the person eats something that has gluten, okay, they will suffer from steatorrhea, that is too much of fat leaves the body because indigestion takes place, okay. And also the color of the excreta is completely different every time. So that's the reason it is called chameleon disease as well, okay. And that is weight loss because nothing is absorbed from the body, because if the villi has been destroyed, what will the intestine absorb? How the patient will become will gain weight or maintain weight, okay, they will lose their weight, okay? The body will go into the state of catabolism, okay. There is increased appetite, bulky oily stools that you will see, that is steatorrhea with too much of fat, and fat along with the fat soluble vitamins will also leave the body, okay. Carbohydrates, disaccharides, everything will be malabsorbed. The patient will go into a state of anemia, okay. The bone diseases because no calcium, no vitamin D is absorbed, okay. uh, Edema because of protein deficiency and severe malnutrition, chelosis, glossitis because of vitamin B deficiency. So all the deficiencies, clinical symptoms will start showing up in the patient's body. Okay, dermatitis, epilepsy, ataxia, okay, liver issues, liver cirrhosis, alopecia, hair will fall down, okay, gastritis, thyroiditis, thyroid issues. This all will start because the patient is allergic to gluten that is present in the diet. Okay. So what you have to do here is this is also called the flat gut syndrome. Flat gut means you can see the villi has completely flattened. Okay, so this is also called the flat gut syndrome. So what is the treatment here? Strictly stay in a gluten-free diet. You can eat all plants or vegetables, but when it comes to cereals and grains, completely avoid wheat, completely avoid maida, oats to an extent, barley, okay, completely avoid all these things. You will be fine. Okay, and also if you are suffering from celiac disease and somebody else in your family, everyone else is normal, okay, so even if you use the same utensils or you uh, use the same mixture grinder, okay, which was used to make something that had gluten, that can also trigger issues in you. Okay, a small amount of gluten which was left over in the mixer grinder and it came into your part of the food, that could also trigger the symptoms. Okay, so it is better to have a completely gluten-free kitchen in your home. Okay, that is desirable. And cereals, millets, pulses, vegetables, fruits, they all, you can eat all of this except for wheat, okay, barley and rye. That is the food that you have to avoid, wheat, barley and rye. Oat is almost gluten-free, but may contain gluten because of cross-contamination. Okay. Rava, suji, maida, biscuit, bread, cake, pastry, noodles, chocolates, malted drinks, ice cream, ready to eat soup, okay, beer, okay, you can't eat all these things. So that's about celiac disease.